Thank you for joining us. The following presentation is from a webinar titled, An Employer's Obligations and Opportunities under the Affordable Care Act, originally produced on September 24th, 2015. The presenters are Suzanne Sentman from McKonly Asbury and Susan Orr from Rhodes & Sinan. Enjoy the presentation and visit us online at www.macpas.com for more information about our future events and upcoming webinars.
Thank you, Tyler. As Tyler mentioned, my name is Suzanne Sentman. I'm the Human Resources Director here at McKonly Asbury. And with me today is our guest, Susan Orr, from the Rhodes & Sinan office out of Exton, Pennsylvania. One of the services that we try to provide our clients through McKonly Asbury is additional resources and support for any questions or concerns that come up, specifically as it relates to the lovely law of the Affordable Care Act, or we say healthcare reform. So with that, I'd like to turn things over to Susan Orr, but first let me tell you a little bit about her. Like I mentioned, she's with Rhodes & Sinan in the Exton office. She represents and advises healthcare providers on a variety of regulatory and transactional areas, including clinical integration and practice mergers, medical records, privacy and confidentiality issues, such as HIPAA, fraud and abuse, healthcare compliance, and provider and facility licensing. Having served as practice administrator for her husband's medical practice for 12 years, Ms. Orr is uniquely qualified to assist clients on practice management issues, including reimbursement and payment issues, Medicare and Medicaid compliance, managed care, employment issues, professional practice formation, healthcare affiliations, joint ventures, and contractual arrangements. Ms. Orr is a regular speaker with the New Jersey Academy of Family Physicians and the Pennsylvania Academy of Family Physicians, and is a regular contributor to both of their publications, respectively the Keystone Physicians and Perspectives Journal. So with that, I'm going to turn things over to Susan. Thank you once again, Susan, for joining us.
Well, thank you very much for inviting me here to speak on the Affordable Care Act. When we were talking about developing a topic for this discussion, I mentioned that in the last couple of months, I've been getting a lot of questions from my clients on their obligations as employers. One of the challenges with the Affordable Care Act is that it encompasses a number of other laws. It's not really a self-contained law, so that when you're looking to try to find what your requirements are, you're looking at the Internal Revenue Code, you're looking at the Affordable Care Act itself, you're looking at HIPAA. So it brings in together a lot of different statutes, and it becomes very confusing for providers and for clients to figure out what their obligations are as employers. And I found that what they've been asking me is really just very basic information, which is what we're going to be talking about today. So I put together an overview of the topics, and we're going to first start by talking about, who's a large employer? What's that definition? Are you a large employer? So by then, we're going to look at, all right, so I'm a large employer, so who do I have to offer insurance to? Who do I have to offer coverage? When does that coverage have to become effective? And does the plan that I have, does that meet all of the requirements under the ACA? We're also going to talk about penalties if you don't offer insurance, or if you're not offering insurance that meets the requirements of the Accountable Care Act. And then finally, we're going to talk about the shop marketplace, which is really an option for smaller employers. So with that said, let's start with the very beginning, and we're going to start talking about the employer mandate. And the ACA uses the term applicable large employers. And who are they? Well, they're large employers, and what are they required to do? Large employers must offer health coverage that's affordable, of minimal value, to substantially all, which is 95% of their full-time employees and to their dependents, in order to avoid monetary penalties. And I read that to you only because we're going to be hitting on the definition for each of those categories, each of those words. Large employers, what do they have to offer? What's the health coverage? What's the definition of full-time employees? What's the definition of penalties of dependents? And what are the penalties?
And maybe that's why it makes it so confusing, Susan. There just seem to be so many moving parts to this.
It is. So it does become very confusing because you really need to figure out, you have to start from the beginning to figure out, am I a large employer? That's really the starting point. And that becomes very confusing, as we're going to see in a few minutes, in determining what employees are considered full-time and who are eligible for coverage. We're going to talk also about measurement periods for variable hour employees. Many of my clients in the healthcare industry have part-time employees. So it becomes a little confusing figuring out, do they have enough employees to be a large employer, and how do they count in when I figure out who do I have to offer insurance to? And we're also going to talk, they also have to look at their health plan to see if it meets the requirements, and of course the penalties and the notices and written policies. One thing that I will mention later on as well is that when I've been looking at many of the employee handbooks that my clients have provided me, many of them have been written years ago, 5-10 years ago. Certain sections have been updated, but many of them have not been updated, especially with regard to the Accountable Care Act. So they're not meeting the same requirements. So you need to look at those to make sure that they comply with the terms of the Accountable Care Act. So the first thing we're going to look at is, what is a large employer? What is an applicable large employer, and that are subject to the mandate? And large employers are those who employ at least 50 full-time employees on business days during the preceding calendar year. Well, that sounds very easy to figure out. It's just, I have 50 full-time employees, not a problem. However, many people hire part-time people. Many of these part-time people are what we call variable hourly employees, meaning that sometimes they work 25 hours, sometimes they work 35 hours, sometimes they work 29 hours. So we need to look at that. And when we look at a full-time employee, it has to be employed on average of 30 hours of service per week, or 130 hours per month. Many of your employee manuals may not describe full-time employees as 30 hours. They may be 35 hours, 32 hours. So for insurance purposes, you need to look at your manual to make sure that these are individuals, that full-time employees, at least for insurance purposes under the Accountable Care Act, are 30 hours. So you need to, when you're figuring out, are you a large employer, you need to take into account your part-time and seasonal employees. So how do you do that? So you know how many full-time employees that you have, perhaps they're salaried, or you know that they're working at least over 30 hours. Those are easy to figure out. When you look at your part-time employees, what you need to do is figure out what is the full-time equivalent. So you look at all your full-time employees for the month, including your seasonal employees. You take a month, you look at them, you add up all of their hours. So if you have 10 part-time employees, and in the month they've worked 50 hours, you add all those hours up, 10 times 50, you add them up, and then you divide that by 120. That number will then be your full-time equivalents. So if you've got 40 full-time people that you know of, then you add your full-time equivalents to see, does that meet 50 employees? And if it does, you then are a large employer. Doesn't mean you have to offer insurance to all those 50 employees, especially to those part-time people, but it does mean that for the determination as to whether you're a large employer, it does meet it. They do count for that. So the next, so when we look at the large employer determination, one of the things you need to take into account is if you have multiple offices, or what happens if you have multiple companies under common control. So if you have various affiliations, when you're determining whether you're a large employer or not, you have to aggregate all of those employees together. So if you own another company, if your main company owns another company, has another division, you need to make sure that you add all of those employees up from that division, from the corporate office, and that's how you would determine whether you're a large employer, by adding all of those up. but that's only for the determination, again, as to whether you are a large employer.
Can you talk a little bit about the seasonal employees?
The seasonal employees are to be counted as well. There is an exception, however. So if you're up to 50 employees, for example, and what brings you over the top is when you're doing your full-time equivalent, and they are the only employees that are over 50 are seasonal employees. They will not count toward your being a large employer. All right, and the seasonal employees could be people in the retail industry where they're bringing people in for Christmas,
right,
or in the spring, in the summer, even the fall, where their landscapers are bringing in people to help with landscaping. So those are really the seasonal employees. They do count, but they don't count if you get 50 and they're the only ones that are above 50. Okay?
Thank you.
So now we know that you're a large employer because you have 50 employees, 50 full-time employees. So what do you have to do next? So again, let's kind of look back to our basic definition. Large employers must offer health care coverage that's affordable, minimal, to substantially all, which is 95% of your full-time employees and their dependents. So what's substantially all? And what's a dependent? Usually when you look at insurance, you think of dependents sometimes you think of it not only as your children, but you also think about it as your spouses. Well, dependents under the Accountable Care Act do not include spouses. So you are required as a large employer to only offer insurance to the employee and to their dependents, which are the employee's children under the age of 26. And it doesn't matter whether that child is married, whether that child's living at home, as long as they're under 26, that you have to offer that to the employee, and they're covered.
But if you have a son or daughter who's living at home who is married, you do not have to offer coverage to that child's spouse, correct?
Correct, right. Right. You only would offer it to your actual child, not to their spouse. Good point. Again, here we talk a little bit about, we've got these part-time seasonal employees. Even though we're counting them in your count to determine whether you're a large employer, we're not going to count them in terms of, do you have to offer insurance to them? No, you don't. You only are required to offer insurance to your full-time employees. That are people who are working over 30 hours a week. If it's less than 30 hours, you do not have to offer insurance to them. So how do you determine your full-time employees? Okay, they're really reasonably expected to be employed 30 hours or more per week on the average, and they've got to be offered health insurance within the first 90 days of employment. And we'll talk a little bit more about that. But it gets a little confusing to figure out, who's full-time. And as I mentioned before, many of you have, maybe salaried employees where you actually know that they're working 40 hours or they're working, 35 hours or 36 hours. So you know how many hours they're actually working a week. And that makes it a little bit easier. But we also have these employees which we're going to call variable hour employees. So the IRS has provided for the implementation of what we call measurement and stability periods, which we will discuss. And you're going to use them to track the status of your employees to determine, are they eligible for coverage or not? And you need to have written policies in place regarding the use of these measurement and stability periods. So we're going to talk about those, so let's try to make it a little bit clearer for everybody. So as I said, sometimes it can be difficult to determine hours worked by salaried employees. And the IRS had said, well, if it's difficult, these are the methods that you can use. You can figure out the actual hours worked from the payroll records, because we're looking at the hours paid. So if you have somebody who's not getting paid for whatever reason, we're only looking at the hours that they're paid. So it's the actual hours worked from the payroll records. For full-time employees, you think about the days that they've worked are working generally around 8 hours a day, and they're working about 40 hours per week. So that's how you can track your full-time. But what do you do with these variable hour employees. And these are people who are working maybe around 30 hours. Some weeks they work less, some weeks they work more. As Suzanne mentioned, I do a lot of work with healthcare providers, and specifically in hospital settings or in some of the large group settings, they have a lot of part-time people who work for them. And they are variable hours because sometimes, the nurses may be working at different offices, and sometimes they're working different shifts. And so consequently, their hours could be all over the place. So how do you determine what those hours are and whether they're considered full-time or not? And the key thing here is that if you don't track them, if you don't track their hours or make an effort to track their hours, you could very well be subject to penalties. So you need to make sure that you're tracking their hours, and we're just going to talk about that right in just a minute.
So not understanding is not a valid excuse.
Right. There's no exception for not understanding it. That's your obligation, is to understand what you're supposed to do. So ignorance is no defense, as they say. So let's figure out how do we track these employees. All right, so we're really looking at the variable hourly employees. So you're going to pick what they call a measurement period. And that measurement period, the IRS said, well, it could be 3 months, it could be up to a year or 12 months. We're actually telling our clients, you want to look at it a year, because for a number of reasons. Number one is that it gives you a good long period to measure their hours. Number two is that it kind of delays actually when you have to provide insurance to them. So if you do it 3 months, at the end of that 3 months, you have to decide whether I offer insurance to them. Now you've got a whole year to make that decision. And you choose whatever length you want, and you choose whenever you want to start it. So you could start it January to December. You could do it, October 1st to September 30th. You could do whatever period you want to do. It just has to be consistent. You can't have some employees on a different measurement period than others.
How do you handle new hires, Susan? Like, let's say, so you are employing the year-long or the 12-month tracking. So if you have someone that comes on maybe, midway through the year, what do you do with that person?
Well, if you know that person's going to be a full-time employee, then you don't have to worry about that. They're definitely going to be working 30 or more hours. That's not an issue. However, if they're hired to work, let's say 28 hours, at this point you don't have to offer them insurance, but you are going to have to track them. And these are people who are when we're talking about tracking, these are people who are neither new hires, or these are people who are just coming on board or who are been with you for a while. So the first period is going to the measurement period. So let's say you're going to pick a 12-month period, and you're going to look at how many hours each employee works during that 12-month period. At the end of the 12-month period, the IRS said, well, you can have an extra month, and we're going to call that month the administrative period. And you can use that month to determine, did this employee work 30 hours? So you're going to do the aggregate numbers, find out how many hours they've worked during the year, divide that by 12, and look to see how many hours did they work a month, because and how many hours did they work a week. And if you determine that they've worked at least 30 hours a week during that month, you then have to offer insurance to them. All right, so you've got your measurement period, which is, let's say, a 1-year period. Month 13 is your administrative period. And then you have your what they call stability period, when you're offering them insurance. Now, the administrative period can be actually up to 90 days, but if you're doing a 12-month measurement period, they limit you to 1 month. All right? So basically, if you're doing 12 months, you have 1 month of administrative time. So once you've determined that, yes, this person has worked 30 plus hours, I have to offer insurance to that person, that next period is called the stability period, and it's the same length as your measurement period. So you have a 12-month measurement, a 1-month administrative, and then you have a 12-month stability period in which you've offered the insurance to this individual, to this employee. So it's for the entire year. So if during that year that person is no longer working 30 hours, is working 25 hours, you have to continue that insurance coverage for that entire stability period. During that time, however, you're going to continue for all your employees that are variable hour, you are going to continue to track them. So every stability period really, in reality, also becomes a measurement period because it's just a continuous loop. You measure them, you have a like period for providing them insurance, during which time you're also measuring them again. So each year you're looking at how many hours they worked and determining whether they've worked 30 hours a week or not. So at the following year, so after your second year, you've offered them insurance, they've had the insurance for the full year under the stability period. All of a sudden, when you measure them, now they're only working 25 hours. You do not have to then offer them insurance for the next 12-month period. You can, if you want to, you can offer that to them and have the employee pay for it, or you could just tell them we're not offering it to you anymore because you're now part-time. So that's how the IRS has come up with this safe harbor for measuring time worked to determine whether they're a full-time employee or not. And they have to apply uniformly, whether it's salaried and hourly employees, whether you've got employees located in different states, working at different business locations. Those are the only distinctions that you can make, all right, in terms of when you're looking at the stability or the measurement period. So now we know you're a large employer. You've got X number of full-time employees that you have to offer insurance to. The question is then, when does this insurance become effective? And this can be a little complicated because what's happening here is we're actually bringing in some other laws, because other laws have requirements as to when you have to provide insurance. And this is an area where I find that many of my clients have some problems with their employee manuals. Many of my clients have a 90-day, what they call probation or orientation period, where basically they're coming in and they're not going to get any benefits during that time period, and the employer and the employee are kind of deciding, is this the job for me? They're doing some training. Do I want to really stay here? And then at the end of the 90 days, a decision is made, yes, this person stays, or no, this person doesn't stay. Well, we have a little issue with that with the Accountable Care Act. Although the IRS recognizes that we have these probationary periods, we need to think about changing some of the wording and think about how we're looking at these people. We have what they call, the IRS has come up with a definition of what they call the waiting period. And this is the period before coverage for an individual who is otherwise eligible to a role can become effective. It cannot be greater than 90 days. That doesn't mean 3 months. It's 90 days. So you need to count days, not 3 months. The other thing that I want to mention is, what does it mean otherwise eligible? Well, basically, that really is pretty much your orientation period. And the IRS said, well, we're going to look at that and say we're going to give you a month, a maximum of a month, and say that's the time where that employee is going to be trained. If you're waiting for that employee to become licensed, that's when that's going to happen. So by the end of that orientation period, by the end of that month period, the waiting period now for the insurance will begin. So instead of calling that 90-day probation period your orientation period, you've got to think about changing that language in your manual. So basically, you've got a 1-month orientation, and then you've got a 3-month waiting period. So how does this work? So we've got 1 month orientation, 3 months waiting period. Well, there's another little catch to this. And one of the other provisions indicates that you have to provide them with coverage beginning on the first day of the 4th month of employment. So if somebody starts to work, say the example that I have here is January 6th, their coverage date is going to be May 1st because that's the first day of the 4th month. So even if they started January 29th, it's still January, so it would be the first day of the 4th month, which would really be, again, May 1st. All right, so this does kind of limit what you're able to do and when you can do that. But you need to make sure that your manual reflects the fact that you only have a month orientation or a maximum of a month orientation and a 90-day or waiting period. This also may affect if you're, for example, we're dealing with, my clients are primarily group practices, hospitals, people in the healthcare industry. And so we require that all of their providers be licensed, whether it's a nurse, or a physician or a technician, that they have to be licensed. So it may affect when they're starting because we may want to hold off until they become licensed before the actual start date, rather than putting that licensure requirement during the 1 month orientation. Because what happens then if the license doesn't come in during that 1 month period? Then that presents a problem. So you really need to think about having them licensed, just when they start work for you.
Or at least cover that topic as part of the interviewing process.
Right, exactly. Exactly. All right, so you're required to provide insurance that's affordable, has minimum essential health insurance, and provide minimum essential health insurance coverage, or face a mandatory shared responsibility payment. So what are we talking about here? So a plan has to be affordable, and what they have indicated is the determination as to whether a plan is affordable if the employee's contribution for his or her own coverage does not exceed 9.5% of the employee's household income for the taxable year. So we're not going to look at the dependent coverage. So if you're providing insurance for, let's say, the employee, the spouse, and the dependents, you're only going to be looking at the employee's portion. So if her premium is $20 and the family's premium is $100, you're only going to look at that $20 and see does that exceed 9.5% of the employee's household income for the taxable year. And you can look at their W-2 to determine that.
So in health insurance terms, this is single coverage only that you're looking at.
Exactly. So the next thing, so that's how you determine whether whether it's affordable. The next one is the plan has to be of minimal value. And this can be pretty complicated, and I would think that many of you might need to rely on your benefits manager or your insurance broker or maybe the plan itself to help you with this, because a plan is of minimum value if it covers at least 60% of the cost of benefits that are expected to be incurred, meaning that of all the medical expenses that are incurred, this plan has got to cover 60% of them, and then the employee's responsibility would only be the 40% of them. All right, so the employees should not pay more than 40% of the cost of the essential health benefits. And as we go along later, you'll see what those essential health benefits are. And there's also the HHS, and I apologize for not including that here, but there is a minimum value calculator that you can use to determine if your plan does have minimum value. You insert certain information in there, and it will tell you, yes, it is minimum value, or no, it's not.
We did have a question come through, and if we could just break here, it
Sure.
seems like let's cover this right now if we could, Susan. Going back a slide where we talk about the coverage, you say his or her own coverage does not exceed 9.5% of the employee's household income. The question that came up was, where do you get household income? Does this could this mean, like, are you factoring in like a spouse if they're working for another company? How is that determined?
Well, basically, you're really looking at the employee's income versus the whole, their spouse's income.
Okay.
So if you just really, as you see in the last note that I have on here, it just says if you're looking in the W-2,
Okay.
you should be okay.
Okay.
All right? So you don't have to get the whole spouse's income. It's one thing if the spouse works for the company, but if not, they're not going to be very willing to provide that for you, and that's going to be very difficult to do. So it's really, you're looking at the employee's income.
Okay. Thank you for clarifying that.
No problem. All right, so what are some of the other large group standards that we have? And some of these you probably have heard of. These are some of the really pluses that that you hear on the news and some of the talk shows that they've mentioned. These are the big benefits for them. First of all, there's no lifetime or annual limits on benefits that are considered the essential health benefits. Your adult children under the age of 28 can continue to be on the child's plan. My son unfortunately turned 26 this year, so in April, so we had to get new coverage for him, but in the past he was always on our plan.
Okay. And there was an earlier question that came up with regard to that age provision. If we can maybe just talk about it now,
Sure.
it seems like a good time. So again, adult children under the age of 26. Does it matter necessarily? Let me see if I can pull up the question. The question that came up was, or comment was, I think that they are covered until the last day of their 26th year, which is different from under 26 years of age.
No, actually, once they hit 26, they are no longer covered. So it's not.
So it's the month in which they turn 26.
Right.
Okay.
So his birthday is April 6th. So starting April 1st, I had to provide him with new coverage.
Okay.
All right. So I was hoping that it would be your interpretation as well, that it was like they could be all the way through their 26th year.
Right.
But that's not the case. It's like once they hit that 26, that you're done. You have to buy new coverage for them, or they have to get their own, or God forbid they don't have coverage, but they do have to. They're on their own at that point. Some of the other things that you've probably heard, there has to be preventative services without cost sharing. Means that there's no co-payment for preventative services. There's no discrimination. You can't discriminate based on pre-existing conditions. You can't charge. You can't have charge people with health problems more than people who are healthy. There's something called this Patient-Centered Outcome Research Institute fee, and it's not a lot, but this is a research organization, and part of the fees, the premiums go to them. There are appeals processes, which is what many people currently have with their insurance now, prior to the ACA. And there are certainly out-of-pocket limits, $6,350 for single and $12,700 for other for in-network benefits. So those are the basic plans. The other thing I want to mention is that as an employer, as a large employer, you're now going to have some reporting requirements. And beginning in 2015, the large employers have to report to the IRS. And the employee also has to report to the IRS when they submit their taxes. As an employer, you're going to be providing them with a form that they will then give to whoever is doing their taxes, and they submit that form to the IRS. Failure to provide these forms is $250 per form.
And Susan, I had a question or comment come up the other day from a client on that. If the person moves, many times, as we know, when employees leave an organization, they don't always tell you where they are going, or
Right.
things can change, addresses can change. Obviously, if they, are expecting a W-2, hopefully they'll reach out to you.
Right,
But
right.
in the case of some of this paperwork, some of the mandated requirements here where you have to reach out to employees who are no longer with the company, Are there any guidance on that as far as, how vigilant you have to be in tracking them down?
Well, we haven't really seen so much because these forms are just fairly new. So we're just going into our first year with this. But I would think that it's going to be the same requirements as for the W-2s.
So whatever address you have on file, you go with that, and
my recommendation would really be to try to be a little bit more vigilant when somebody leaves. First of all, you should always be doing exit interviews.
Sure.
And try to get an address for them. If they're not sure where they're going to be going, see if you could get a family's address or somebody so that you're going to be able to send them something. You'll have an address at which to send them the form as well as their W-2.
But I would think that if you make a good faith effort, you send it bounces back.
Right, exactly,
Yeah.
exactly. So there are 3 forms. I'm not really going to go over them, but I did provide them with you, provide them in the attachment for you, so at least you could see what they are. The form 1095A is really for the individuals who purchase insurance on an exchange. B is going to be issued by the insurance carrier. And it's people who work for a fully insured plan, meaning that, the company just pays their premium to Capital Blue Cross or to Highmark or to another insurance company. The company pays the premium and they provide all of their insurance. And the last form is something that you will need to be looking at, and it's the Form 1095C. And this is to be filled out if the employee and the employer is self-insured or if they are a large employer, and meaning they have 50 or more employees. And this is the form that you are required to provide to the employee, and you're going to have a cover sheet that you're going to have to submit also to the IRS. And the reason they have 1095C is really this is how the IRS is going to really be checking to see what you're doing. They're going to make sure that you are providing insurance to all of your full-time employees. They're going to be making sure that you are providing insurance that meets the minimum requirements, the affordability requirements. So this is how they're going to be looking to see whether you're going to be subject to a penalty or not. If you go to the IRS website, these forms are there, and they have detailed instructions as to how to fill them out. Right? It's not complicated, but it's very time consuming. So you really need to get organized and really start thinking about, starting in, at the end of the year, I'm going to have to do this for each of my employees. And if you have quite a few employees, it can be a large task. 1095C, as I said, I've provided you with the form. I'll just mention Part 1 and 2 you will complete. Part 3 is only to be completed if the employer is self-insured. So if you just pay your premiums to an insurance company for your employees, you're not self-insured, you don't have to do Part 3. But there's still quite a bit of information that you need to record on here, so you need to start looking at that and seeing what you need to do, because you do have to provide this out to the employees just like you do your W-2s. So you don't have a lot of time to do that. So the last thing I want to talk about in terms of the large employer is the penalties. And I've gotten a lot of questions about the penalties because some of my clients have said, well, maybe it'd just be cheaper for me not to offer anybody insurance. What are these penalties about? Can I get away with not offering insurance? Well, there's 2 penalties, and you're really going to be subject to one or the other. The first one is if you offer no insurance whatsoever to any of your full-time employees, or let's say you offer insurance to 90% or 80% of your full-time employees, but not all of them. If you remember, your requirement as a large employer was to provide insurance to substantially all, that is 95% of your full-time employees. So if you offer insurance to less, you're going to be subject to this penalty. And the thing about this penalty is it doesn't really matter whether you offer it to all of your employees, if you offer it to 80% of your employees or you offer it to none of your employees. The penalty is $2,000 multiplied by the number of full-time employees minus 30. So the IRS gives you a little bit of a break and say, all right, we're not going to count the first 30, but it's $2,000 for each employee. It's not $2,000 for it's 20% that you didn't offer. It's $2,000 for all of your employees. So that if you have, let's say, as the example says, you have 50 employees, and you don't offer coverage at all. You take 30 from the 50. You've got 20 employees. 20 times 2,000. You owe the IRS $40,000. And again, it doesn't matter if you're just offering it to 80%. And you're just short 15%, you're still going to be hit with the $2,000 for every full-time employee. For providing inadequate insurance, meaning that you are providing insurance, but it doesn't meet all of the requirements that you're supposed to have in there. Maybe you're just offering a health reimbursement account, or maybe you're just offering something that's a very minimal coverage. You're going to be hit with a fine. So it's not the same fine as the first one. So it's a little bit easier because even though it's $3,000, it's $3,000 for each employee that receives a tax credit through the exchange. So what's going to happen, and it could happen in both of these, where you're not offering insurance or you're not providing adequate insurance, your employee then goes to the exchange and gets a tax credit and purchase insurance through the exchange. The first one doesn't matter. You're still going to get hit with the $2,000 for all your employees. But in the second one, it's only $3,000 for each employee who receives a tax credit through the exchange. All right. So that's the large employer. So the next section here is the small business health options program called the SHOP program. And this program really is open to employers with 50 or fewer full-time equivalent employees. However, in 2016, they're increasing it to 100. There's a lot of good options with this. And if we look at the next slide, we'll see that we kind of list what some of the advantages are. Is basically you can kind of control the coverage you offer, how much you pay toward the employee premiums. You can go through a broker, you can go through an agent. You're able to get these plans at any time. All right. You can start them mid-year, you can start them 3/4 of the way through the year, whenever you want to offer them, you can. And you have the ability to compare health plans online. And you also, which is also a nice benefit, is you can possibly qualify for small business tax credit. And that's worth up to 50% of your premium cost. And you can still deduct from your taxes the rest of your premium costs that are not covered by the tax credit. So that is a big benefit. So we're going to look to see if you qualify for that. So how do you qualify for these tax credits under the SHOP plan? Well, first of all, you have fewer than 25 full-time equivalent employees, and they make an average of less than $50,000 a year. So you have to pay at least 50% of your full-time employees' premium. All right, so you pay 50% of your full-time employees, and if you could get a 50% tax credit, you can provide them with some, fairly reasonable insurance for a much cheaper price. You don't need to offer coverage to your part-time employees, nor do you have to offer it to the dependents, which is another benefit. And as I said, you get a tax credit up to 50% of your contribution. There's a sliding scale depending upon how many employees you have. So the fewer employees that you have, you're actually going to get a larger tax credit. All right. What are some of the health options? Well, I'm sure if you've gone to the marketplace, you've seen that they have all these different colors of insurance: the bronze, the silver, the gold, the platinum. And the shop marketplace also has them. So we've got 4 plan categories based on, your employees and the plans, and how much you expect to share the cost. So the bronze plan covers 60% of the average cost of care. The silver is 70, gold is 80, and the platinum is 90. We talked earlier about the essential health benefits that you have to offer. These are the minimum requires that you have to offer. You can offer more, but these are the minimum. And these are the minimum for the large employers as well. They're, preventive wellness and disease management services, flu shots, physicals. We have emergency care, going to the emergency room at the hospital or going to an urgent care center, ambulatory services. If you're going to an ambulatory surgery center to have a procedure done, or if you're just having blood tests done or x-rays, hospitalization, maternity, newborn services, pediatric services, and this is really nice because it does include dental and vision. So these are part of the essential health benefits. Prescription drugs, laboratory services, mental health and substance abuse services, including behavioral health treatment. And one of the big things which I did want to mention is that, as we all probably are aware, mental health has always been given the short shift when it comes to coverage. Many organizations don't, many plans don't cover it, and even when they do cover it, the benefits are very minimum. So with the ACA, one of the benefits is that there is parity. So what they offer in terms of your physical health, they have to offer the same type of benefits for your mental health. And this is really a big plus for people who suffer from various mental health issues and people who suffer from alcohol and drug abuse. And finally, there's the rehab and rehabilitation services like physical therapy, speech therapy, and so forth. So how do you enroll in it? Basically, as I mentioned, you can apply for coverage at any time. You just submit your application by the 15th of the month, and that coverage will occur on the 1st of the following month. So if you enroll by April 15th, coverage will begin May 1st. If you enroll between the 16th and 30th, coverage will begin June 1st. So you can go through your licensed agent or broker. You don't pay more for it just by going through your broker or your agent. And sometimes I think they can help you kind of go through this and help you through the process. I mean, it is very confusing. It's very confusing if you're not familiar with it, if you're not familiar with all the different plans and policies, and just figuring out, how do I know what's covered? How do I know if this plan is better than the other? And a lot of times your broker can help you kind of weed through those. So, with that said, that is the overview of the employer's obligations.
I do have a comment, observation, maybe question for you, Susan. So we know that applicable large employers right now are between 50 and 100, correct?
Right.
So with SHOP opening up or expanding that coverage in 2016 to now include those with fewer than 100, is it possible for an employer who is now considered an applicable large employer to move maybe into that SHOP
Yes,
sort
that's
of
my
arena?
understanding that yes, they can, because now they've increased it to 100, so they're able to now become part of this, and this may really be a big benefit for those people who have the 50 to under 100 employees. One of my clients just called and he said, I don't know what to do because now I have to offer this insurance to the dependents and to the employees, and I have to offer the same premium, and it's going to cost us a lot of money. What do we do? And certainly this may be a good option for them.
Seems like there's more flexibility to it.
Right, there's more flexibility. They may be able to get a tax credit for that. So, and they have to pay only 50% of the premium. So there are certain benefits to that. And I think that they're realizing that, a small business is not really over 50 anymore. Small business is really 100 employees and less. So
Just not for 2015.
right, just not for 2015. Right, not for 2015. So it's fine for 2016, and I'm sure as we go along, we're going to see lots more changes. We're still waiting for additional regulations to come out. One of the things that we didn't touch on, but I've had a number of questions on from my clients, is working through what can I offer to certain groups of people versus other groups of people. Can I offer hourly employees one type of coverage and salaried employees another? Can their premiums differ? And that becomes very complicated because, we're looking at the IRS regulations for doing an entire analysis under, well, in that case, are the salaried employees, are they highly compensated employees? And does that mean then you can't offer that? So we're waiting to see if we can, what the regulations are going to say with regard to that, because what's happening now is you're discriminating against certain groups of people. So we cannot do. So we're waiting for those regs to see what's going to happen with them. So stay tuned. We're hoping that they're going to come out at the end of the year. They probably will then be effective January 1st. They're predicting they're coming out Thanksgiving weekend.
Nice.
So, and I'm sure as time goes on, we're going to see more and more changes to this law, and hopefully, the changes will be better for a lot of our clients who are kind of struggling to figure out what they need to do and what's the best approach for them.
Right. I think we can all agree to that.
Yes.
So before we take any questions, there have been some questions that have come through. I'm going to turn things back over to Tyler for a little bit of housekeeping. Thank you, Tyler. So earlier, Susan, a question came in about determining, again, the full-time equivalents, or how you go about calculating that number and factoring in any part-timers, any seasonal help. A question came through about what if they are part-time interns just for the summer? So here again, I know that there are other intersections with other laws out there. I know the Department of Labor had a lot to say about interns, unpaid interns, that is. So with regard to healthcare, what do we do with those interns?
Well, I'm assuming that in this case they're paid interns. So basically what you're going to do is you're going to look at them. If you're doing if you're looking at a month, I think you want to pick a representative sampled, and you may want to take take a longer period of time to figure out, are you a large employer or not? And when you add those people in and they're part-time, does it put you over the top? So you would need to continue to count them and determine whether I need to add those in.
Okay, thank you. Looking through, it looks like some other questions are coming in. The other question was, could you tell us if the SHOP credit is an ongoing annual credit or if it's only for the first year?
It's my understanding that it's ongoing, that it's not just for the first year. I mean, certainly that could change, but it's my understanding right now that it would be for each year that you participate.
Okay. And let's see. So another question that came through here. If our company did not become a large employer, that's in quotes, until September 2015, would we be required to file the 1095-C for 2015?
So if you're not a large employer, so you're beyond less than 50.
But you became a large employer later in this year.
This year. That's an excellent question, and I have to say that I really don't know whether you would need to do that or not. And that's something that I'd be happy to get back to you on, and I could get back to you, Suzanne, and let you know,
Sure.
and we can post that someplace so that I can check into that
Sure.
to see. That's generally not come up because I know we've had these issues where somebody have said, well, I know I'm going to be a large employer, but we're hiring all these people in March. What should I do? And they've elected to become a large employer starting to follow the requirements starting in January, knowing that they're going to have all these additional employees in a couple of months. But in terms of the 1095C, that's something that I haven't seen yet, so I'll have to look that up. I'll have to look and see.
And are there good, just a comment with those filings, as you pointed out, that's new for this year.
Right.
So we're all looking at this for the first time, right? Is there like a safe harbor provision in effect, or is there like a good faith sort of filing where, hopefully your information matches maybe that of the insurers, or, you're trying to reach out to those folks, those terminated employees? I mean, are there some protections there built in for employers?
I would think they're going to be, especially, in the first year, because it is going to be difficult to do and trying to match up all this information. I would think, and in terms, even with this question about, should I file as a large employer, I think you need to err on the side of caution and just file it anyway. I think that's probably the better approach, rather than not filing it and then getting hit with a fine. So it might be better just to do that.
Okay. Well, certainly we can funnel that maybe information back to that specific person.
Okay.
And that being said as well, I believe we had our contact information listed at the end of the slide, the last slide. So feel free to reach out to either of us.
Yes,
we would be
please.
happy to take your questions.
Yes, please do. Please feel free to give me, you have my email address. I'll be happy to answer some of these questions. And as we said, a lot of this we're still kind of feeling out. And even though we have regulations, we have laws, sometimes how you interpret them really differs, and you have all these different scenarios that come up. And so we really have to wait until some of these things come into play, until we see what actually happens, and the government or the IRS or the agency actually reacts to them. A lot of times they will have frequently asked questions online, and certainly a lot of times that's really a good place to get information to.
Okay. Well, I think that it looks like we don't have any other questions at the moment. So I want to certainly thank Susan for spending a good hour with us.
You're very welcome.
So thank you so much. It was a pleasure to have you. And I hope everyone enjoyed the presentation. And again, feel free to reach out to either of us if you have any questions or further thoughts. Thank you.
Thank you once again for joining us for this presentation, produced by McKonly Asbury. We hope you join us and participate in our upcoming events. You can stay up to date with news and learn more about our future events by visiting us at www.macpas.com. Thanks again and have a great day.